In tonight's Healthier Me, the numbers are shocking. About 79 million Americans currently have human papillomavirus, or HPV. But many people with the virus don't know that they're infected, according to the CDC. Valley News Team's Giovanna Simic tells us what women and men can do to prevent cervical cancer and stop the spread of HPV.
Ladies, listen up.
Over the last 30 years, we've decreased cervical cancer rates in our country by more than half because of screening.
January is Cervical Health Awareness Month. The National Cervical Cancer Coalition says nearly 13,000 women in the U.S. are diagnosed with cervical cancer each year. But the disease is preventable with vaccination and screening.
Pap smears are very good at looking for abnormal cells and HPV, which is the virus that causes cervical cancer.
But it's not just women who need to pay attention to this silent killer.
Most people at some point in their life, up to 90%, are going to be exposed to HPV.
Currently, there is no HPV test recommended for men. The only approved HPV tests are pap smears for women. So getting the vaccine is your best source of protection.
The HPV vaccine is really important because we have definitely seen a decrease in abnormal cells as well as precancer and cervical cancer after HPV vaccine came into use in the early 2000s and late 90s.
While the vaccine isn't required, it's recommended that children get it between ages 9 to 11 so they're fully protected before they become sexually active. But even if your children are older than that, health officials say there's still time.
If you haven't received the HPV vaccine, you can actually get that vaccine all the way up through age 26 as a catch-up vaccine.
In Fargo, Giovanna Simic, Valley News Live.
The CDC recommends 2 vaccine doses for 9 to 14-year-olds, and teens and young adults who start the series at ages 15 through 26 need 3 doses of the HPV vaccine.